This video is about the renal failure. What is renal failure? Renal means something related to kidney, right? Failure means if something cannot do its function properly, then we can say it as a failure. Okay, so renal failure is the condition in which kidney cannot properly do its function. Okay, otherwise it is a condition in which the kidney loses its ability to properly function. Okay, what are the functions of kidney? The ultimate function of kidney is the filtration of blood itself, right? By filtering the blood, it removes the excess of waste materials to the exterior from the body, and it also balances the fluid and solute concentration in blood, right? So this is the ultimate or major function of the kidney. Okay, so secondary function, the kidney also has to do some other functions also. Okay, along with this filtration, kidney has got many other functions too. Which are they? First of all, the kidney maintains the calcium level in blood by the production of calcitriol, right? So in the beginning of class itself, we have discussed about the function of kidney. One of such function is the production of calcitriol. Calcitriol is the bioactive form of vitamin D, right? So you know that vitamin D is very much essential for the absorption of calcium ions from the gastrointestinal tract, right? That is why the calcitriol is having a role in maintaining calcium level in blood. Okay, so the kidney regulates calcium level in blood by means of the production of calcitriol. Okay, and another function of kidney is the production of erythropoietin. Okay, you know that the erythropoietin is secreted by the interstitial cells of the kidney. Okay, what is the function of erythropoietin? This erythropoietin is very much essential for accomplishing or make possible all the stages of erythropoiesis. That means the RBC production. Okay, so you know that it is a step-by-step process, right? RBC production. In all these process, for the proerythroblast to become the mature RBC, what is needed? Erythropoietin. Okay, so this erythropoietin is a hormone which is produced by the kidney. That is another function of the kidney, right? And of course, by the excretion of excess H+ ions, by the retention of bicarbonate ions, it also makes possible the balance between the acid and basic components of the kidney. That means it is having a role in maintaining the acid-base balance of the body. Okay, so these are all some of the function of the kidney. What happens if the kidney cannot do all these functions? It can shatter somewhat all the physiological activities in body, right? If the kidney cannot maintain the acid-base balance, means the cells in the body cannot function properly, right? If the kidney cannot produce calcitriol, means the calcium level, the calcium metabolism in body can be totally disrupted, right? The calcium level in the blood can be decreased. Okay, suppose if the kidney cannot produce erythropoietin, what happens? RBC production stops. Okay, so the blood volume can decrease. So almost all the physiological activities in body can be stopped, can be disrupted if the kidney is having some difficulties in doing its job. Okay, so renal failure is a very important topic to discuss. Okay, suppose if the kidney cannot proper well, how can we manifest it? How can we diagnose it? You know what is GFR, right? GFR is glomerular filtration rate. Okay, the renal failure can be examined by measuring the GFR. What is GFR? GFR is the filtration rate. Okay, the amount of substance that can be filtered from the blood into the nephron per each minute. Okay, that is what is called as the glomerular filtration rate. If we can measure glomerular filtration rate, we can estimate if the kidney is having some failure or not, right? If the glomerular filtration rate is normal 125 per minute, 125 ml per minute, then we can say the kidney is having no problem. Okay, suppose if the glomerular filtration rate is decreasing than that of the normal, okay, if the GFR is, suppose it is 100, it is much lesser than that of 125, right? If the GFR is decreasing, what we can estimate? We can estimate that the kidney is having some difficulty in filtering the substance. Okay, so the GFR can be considered as a best index for the renal failure diagnosis. Okay, so if there is, suppose if the 50% of the nephrons, you know that the kidney is made up of millions and millions of nephrons, right? If half of the nephrons are dysfunctional, if half of the nephrons in the kidney is not working properly also, the GFR cannot alter that much. It cannot affect the body functions. Why? Because the other nephrons which are functional can compensate the condition. Okay. എന്നുവെച്ചാൽ കിഡ്നിയിൽ ഒരു 50% നെഫ്രോൺസ് വർക്ക് ചെയ്യുന്നില്ലെങ്കിലും ബോഡിയിൽ അത്ര ഇഫക്റ്റ് കാണില്ല. കാരണം എന്താ, ബാക്കിയുള്ള നെഫ്രോൺസ് ഇതിന്റെ ഫങ്ഷൻസും കൂടി ഒരുമിച്ച് അങ്ങ് ചെയ്യും. സോ ഇറ്റ് ക്യാൻ കോമ്പൻസേറ്റ് ദ ലോസ്. Okay, so if the kidney is severely affected only, we can find some of severe changes in body. So this renal failure can divide into two conditions, which are the acute and chronic renal failure. So depending upon its nature, the renal failure can be divided into two, the acute and chronic. Okay, what is acute? Acute means some condition which is having a sudden onset, right? Which starts very suddenly and it will be having an effect very severe. Okay, the acute condition is sudden in onset and it can make the condition more severe and sudden. Okay, that is what is called as the acute. What is chronic? Chronic means it is not sudden. It can start and it can progress, gradually it can progress and make the condition worse. Okay, that means it can persist for a long time. This is long developing condition. Okay, chronic, it does not start all of a sudden, but it gradually progresses to a worse condition. Okay, that is what is called as the chronic renal failure. Okay, so first we will discuss about the acute renal failure. If the kidney is having a sudden damage, what are the symptoms and what are the causes for that? We will discuss that. First one, it is the acute renal failure. Okay, so in acute renal failure, what are the causes? First one, it is renal tissue damage. So suddenly, if the tissues of the kidney is getting damaged, if the nephrons of the kidney or the tubules or renal corpuscles, any part of the nephrons is getting damaged, what happens? The nephrons can be dysfunctional. So the kidney cannot do its function properly, right? So the renal tissue damage, mainly it can be caused by some toxic substances like lead, mercury, carbon tetrachloride. Okay, these are some toxic substances which can immediately make some damage to the renal tissue, okay, or the renal parts. So it can make the nephrons dysfunctional. Next one, it is the acute nephritis. What is nephritis? Nephritis means inflammation in the kidney. Okay, so if the kidney is having If the kidney is suddenly becoming inflamed, it is known as the acute nephritis. Okay, so it can be caused by bacterial infection. If the acute nephritis is caused by bacterial infection, we can call it as pyelonephritis. If it is characterized by any damage of the glomeruli, if the glomeruli is having inflammation, we can term that condition as glomerulonephritis. If the interstitial portion of the nephrons is inflamed, it can be termed as interstitial nephritis. So there are so many gradations, so many sub disorders which we can find in nephritis. Okay, nephritis is simply the inflammation of kidney. Okay, what happens if the kidney structures are inflamed? That part of the kidney will not function. Okay, that part of the kidney will not filter the blood. Okay, so the renal failure can occur by the kidney nephritis. And third one is renal ischemia. What is renal ischemia? Ischemia means the blockage of blood supply. Okay, if there is any deficiency of blood going into one or both of the kidneys, it can be termed as the renal ischemia. Okay, usually it is by the constriction of the blood vessel or the obstruction of the blood vessels. You know, the blood vessels that going into the nephron is arterioles or arteries, right? Artery is the blood supply into the kidney. So if there is any constriction of this arteries or arterioles, arterioles are minute blood vessels that going into the nephrons, right? So if the blood supply is narrowed, what happens? That area will not get blood. Okay, that particular nephrons will not get blood, so the filtration does not occur. Okay, even if there is blood, it can filter. Even when the blood supply is blocked, the nephrons cannot filter. Okay, so it is usually by the constriction of blood vessels or by obstruction of blood vessels if there is any hindrance in the blood vessels. Okay, if the blood cannot go smoothly through the blood vessel, that also can be a cause for this. So it is renal ischemia. And next one is acute tubular necrosis. What is necrosis? Necrosis is the cell death. Okay, if the cell is getting damaged and if the cell is dying, that condition we can term it as acute necrosis. Acute tubular necrosis means if the tubular cells, that means the epithelial cell lining of the tubules, is dying and tearing off, it cannot properly function. The reabsorption, secretion, all that process does not occur. Okay, so the usual process of urine formation does not happen. So acute tubular necrosis is the death of the tubular cells. Next one is the transfusion reaction. What is transfusion reaction? If the blood is injecting into body, okay, if the blood is supplied from an external source into our body, we have to take care that it is compatible blood groups. Okay, if it is not, if it is incompatible transfusion, what happens? It can make the blood clot, right? So it can make the blood coagulate. In that case also, the blood supply into the kidney can be disrupted. Okay, transfusion reaction means some reaction that takes place in the body if incompatible blood is supplied intravenously into the body. Okay, and next one is sudden fall in blood pressure. Okay, if there is a chance for high blood loss from the body, okay, if some injury happens, a deep injury happens, so excess amount of blood is getting loosed. Okay, so what happens? the blood pressure can be decreased. If the blood pressure is decreasing, the usual or proper amount of blood cannot go into the kidney. Okay, so if the blood is not going into the kidney, the filtration also does not occur. And next one is the blockage of ureter. So what is ureter? Ureter is the muscular pump that arises from both of the kidneys into the urinary bladder, right? It is the it is a tubular portion just after the kidney. Okay, it is what is called as the ureter. What happens if the ureter is blocked? How the ureter can be blocked? By kidney stones or by some development of tumor cells. Okay, ureter can be blocked by renal stones. What is renal stones? If the secretion of water and sodium does not taking place properly, this concentrated urine can sometimes make stones. Okay, that means stones are the deposits, the hard deposits of minerals and acid salt. Okay, that sometimes can stick together to form stones, right? If the secretion of water is not taking place, what happens? This concentrated urine, some of the minerals and salts in the concentrated urine can stick together forming the kidney stones. Okay, so the kidney stones, while passing through the ureter, it makes it more painful. Okay, so the kidney stones can also block the ureter, and also by development of tumor or cancer cells in ureter. So these are all some of the causes of renal failure. Okay, some of the reasons for the kidney not to function properly. What are the symptoms we can see in such cases? First symptom is oliguria. Okay, whatever the problems of kidney, the ultimate effect is urine formation, right? Ultimate effects it is just manifested in the urine formation, right? So oliguria can be termed as the primary symptom. What is oliguria? Oliguria is the decrease in the urine formation or urinary output. Okay, oliguria is a condition in which we can see a decreased amount of urinary output. Second one is anuria. What is anuria? Anuria is the total cessation of the urine formation. Okay, if the urine formation gets stopped, the urine formation does not happen in the kidney at all. Okay, such condition is known as anuria. If the kidney cannot properly filter the blood, what happens? The urine formation does not occur. Okay, if the condition is more severe, both of the kidney stop producing urine. Okay, such condition is known as the anuria. Third one is proteinuria. What is proteinuria? Proteinuria is the condition characterized by presence of proteins in the urine. Okay, so the urine can sometimes seem more turbid. Urine can seem sometimes more cloudy. Okay, thick urine will get by the accumulation of protein in it. Why? Usually during the filtration, we know that the protein is excluded, right? The macromolecules like RBC, the proteins, plasma proteins, all these proteins are excluded from the filtration. What is getting filtered? The plasma only. Okay, the water and solutes in the plasma, only these components are getting filtered, not proteins. Okay, sometimes if the filtration is not taking place properly, if there is some damages in the glomeruli or in such cases, we can find the filtration of protein also. Okay, more specifically, it is the albumin. You know, the major protein, plasma protein of blood is albumin. Okay, if the filtration is not taking place properly, what happens? There is a high chance of observing the presence of this albumin into the urine. Okay, that is what is called as the proteinuria. Next one is the hematuria. What is hematuria? Hematuria is the presence of RBC or the presence of blood. Okay, it is most specifically manifested by the presence of RBC. Okay, hematuria is the presence of blood in urine. Okay, so this can happen when there is any urinary tract infection or kidney stones or abnormal filtration itself. Okay, if the filtration is not taking place properly, even the RBC can also filter into the urine. Otherwise, it can be caused by kidney stones. Okay, you know that kidney stones, while passing through this ureter, it can make bleeding. Okay, and also urinary tract infection. In all these cases, we can find the presence of blood in the urine. Next one is edema. What is edema? Edema is the accumulation of water in the extracellular fluid. That means the increase in the volume of extracellular fluid. Okay, so what happens if the kidney is not properly reabsorbing the sodium and water? Okay, suppose the kidney is not doing properly the secretion of sodium and water. That means the sodium and water is retaining within the body itself. Okay, what is filtration? Filtration is the removal of excess amount of this water and also some toxic materials. That is what is called as the filtration. That is what is called as the process of urine formation, right? So, if the excess water and sodium is not going through urine, what happens? The water and sodium can accumulate in the body. Where it accumulates? In the extracellular fluid, mainly in the blood. Right? So, the blood volume along with the tissue fluids also can increase. These volumes can be increased, making edema. Edema എന്ന് വെച്ചാൽ എന്താ? നീര്. അല്ലേ? So these water can be deposited, making swellings in that portion. Okay, that is what is called as the edema. What happens if the blood or the tissue fluid or the blood volume is increasing? What happens? Obviously, it can increase the blood pressure, right? That condition is known as hypertension. Okay, if the kidney cannot produce normal amount of urine, that water can be accumulated in the blood itself. So when the blood volume increases, it can make the blood pressure increased. Okay, so hypertension or the increase in BP is also one of the symptoms of the renal failure. And next one is ascidosis. What is acidosis? Acidosis, we have already discussed, the accumulation of the acidic components of the blood, right? So, in all metabolic process, we know that there is the release of carbon dioxide. Okay, this carbon dioxide and on accumulation with blood plasma, it can release H+ ions. Okay, it can make first carbonic acid. This carbonic acid can dissociate into H+ ions, right? So this H+ ions can increase the acidity of the blood. Okay, that condition is known as the ascidosis. That means the accumulation or the increase in the acidity of the blood. That is what is called as the ascidosis. So this acidosis is not, it is not making a proper atmosphere for the cell metabolic purpose. Okay, so if the acidosis is increasing, it can ultimately result in coma. What is coma? Coma is the unconsciousness. It can be characterized as the prolonged unconsciousness of the body. Okay, if the brain cells are not functioning properly by the accumulation of H+ ions, what happens? The neural coordination cannot take place in body, right? So what happens? Ultimately, it can make the patient in coma, and if this situation persists for some time, it can even result in death. Okay, so these are some of the features or the symptoms we can find in case of acute renal failure.